Good morning to everyone who has joined us here today. I'm grateful to be with you this Friday and appreciate all of you being willing to convene once again. I was unable to meet last week as I experienced my personal bout with COVID, and am grateful for all of the advisement of caution that all of you have presented throughout this time, all of the medical health professionals and all of your work to keep us healthy and informed, and just appreciate all the efforts around testing and vaccination. I'm grateful to be feeling much better, and I am in my last day of isolation and certainly am looking to being back out. But with this experience, again, I just now take a lot of what we've been talking about a bit more to heart. We are currently in our under emergency order still here at the county. It is due to expire February 22nd. And with that, we have been holding our meetings virtually. Plan to hold our zoning meeting next week virtually, and we'll continue to rely on the advisement from this meeting and data that I'm very fortunate that you've been sending me throughout the week to determine whether or not we will renew that order. It provides a level of caution to our public about where we are with the pandemic. We usually provide the rates of transmission, the positivity rate, and the impact on our hospital system, with advisement for people to still get vaccinated and boosted and to wear masks. That, however, does not impose a mask requirement on our facilities. That would be under the purview of the county manager. And so she takes that emergency order and then determines how she'll respond with what goes on in our facilities. And we currently have a mask requirement in place, and we just loosened up some restrictions in our county facilities where I believe all the distancing requirements have been lifted. With that, I have Cassie Maslam here. She's our Director of Emergency Management, and she can help provide more of an update on things that are going on in the county.
Good morning, everyone. The week prior, we had 80 cases of COVID in the county, and that was the report I was going to give last week. I'm happy to say this week we're down to 25. We're starting to see departments with smaller numbers, 1 to 2 instead of 7 to 8, which is a good sign. Our public safety department is always the highest. The week we had 80, the sheriff's office accounted for 45 of those. And this morning they told me they only had 4. So that's a much better number, a much better issue here in the county that we're seeing. So we're very happy about that. I'm sorry to say that our rapid test order was again delayed. Unfortunately, we had partnered with a vendor that just did not follow through. We had high hopes for that vendor. They had delivered for DeKalb County, and they were kind enough to give us 1,000 of their tests. So we were, hopeful that those would come through. They didn't again. So we went directly to iHealth, and they received payment on Monday, and those tests shipped out on Tuesday. So we should get those next week. And very happy about that. As soon as we get those, my office will be working to deliver to the nonprofits that we have promised and the food distribution sites. And then we will be setting up 3 distribution sites, one at Truist Park, Lot 29, Piedmont Church, and the Word of Faith Family Cathedral. So we'll be doing those as soon as we get the test in hand. We'll work with the commissioners to make sure we get those 3 events scheduled, and then all the tests out to our nonprofits. We were also able to assist in getting a blood drive scheduled for March 10th, hearing the urgency for blood here on this call. The chairwoman wanted us to help in that matter. So on March 10th, I'm happy to say we will have a blood drive here in the county from 9 until 2 at the Cobb County Civic Center. So we are encouraging our employees to attend and also opening that up to the public. And that's my report.
Thank you, Cassie. Appreciate that. With that, Dr. Chapman, I'll turn things over to you and your team at Wellstar.
Good morning to everyone, and happy Friday. As Chairwoman Cuban and I were lamenting before it started, we made it. It's Friday. We're going to keep forging ahead. We have the Wellstar team on the line, and a few of them will be giving updates, and others will be available for any questions that we have. But we continue to stay in the fight, and today we do have some good news. Before I dive into more specifically about the numbers, we still are, running hospitals and business units, outside of the COVID activity, and we have a lot going on that still impacts the health of our community. One is that this is Heart Month. We have a robust array of cardiac programs, all the way from prevention to if you are ill and need rehab and being able to get back with your family. So with this, we are encouraging Healthy You in 22. That means that getting all of your screenings, following all of the guidelines for Heart Healthy, and especially if you have illness, to please consult your physicians, and if an emergency, absolutely come through our emergency department. We also, I know everyone knows that this is Black History Month. This is particularly interesting for us as healthcare. We'll be focusing on some of our amazing heroes during this month, who have again paved the way for us within the healthcare setting, and celebrating our heritage, our triumphs, and even our adversities. And I know that each of us have our own personal stories about why Black History Month is very important to us. Speaking of Healthy You in 22, we're not going to bore you, but we're going to still keep saying that we would like to encourage everyone to continue to wear their masks, continue to follow the 3 W's, and most of all, continue to get vaccinated, including the booster. But specifically with the numbers, I did say that we have some celebration. Last week, we were at 461 as a system. Today, we're at 332. We have not seen numbers that low since December. And so good news story, but we still are continuing to be very vigilant, and we cannot let our guard down now. The largest percentage of those patients continue to be unvaccinated. We still have a high number of those patients who are needing ICU care once they are sick enough. Again, we know that the vaccine works. We still have a high number who are on the ventilator. With that, though, we also are seeing our patients, like during COVID, we always have patients who perhaps delay their care. And in that, we start to see other patients with other comorbidities coming back to the organization, some sicker by way of that there was a slight delay. We're working also with our surgeons and our proceduralists to make sure that we're able to, again, continue to provide elective surgeries and procedures that patients need outside, again, of the COVID pandemic. The good news also, I know it's always at the tip of everyone's tongue, is visitation. With the decrease in the number of cases, all of our hospitals are allowing visitors. We still are trying to be very, very vigilant in terms of not having, large masses of visitors in each of our hospitals and our patient rooms. But we feel that this is an important part of the care continuum. And with the numbers and the incidences that we see, we have no hospitals are in the red. So therefore, that's a good news. Specifically for Cobb, being Keystone Hospital and Cobb Hospital, those 2 hospitals oftentimes see the largest percentage of COVID patients. Today at Keystone, we're at 125. Last week, we were at 154. And at Cobb, we are at 31, and last week we were at 55. So those numbers, again, are consistent with our overall numbers. And we're just going to keep celebrating and praying and being very, very vigilant. With that, I am going to turn it over to Dr. Brandstetter. His agenda today is a little bit more robust, that he'll be standing in with giving some information that Dr. Memark in the past has given, and she was not able to join us today. And then we'll turn it over to Stephen. Last week, Stephen punted his to Lisa. This week, he has assumed update with her updates included in his. So the two of them will have most of the rest of the update, Chairwoman Cubitt. And with that, I'll turn it over to Dr. Branstetter. Good morning to you.
Good morning. Thank you, Dr. Chapman. Today, I will do my best to cover the case numbers, vaccination status, some treatment, prevention measures, and some path forwards, and some ask and of the community members and how they can contribute to what's going on within our healthcare realm this current time. I would say and refer people to the Department of Public Health's daily status update report for specific numbers. But let's look at those for a moment. In our case number rate and number of cases as of January 27th, we were having somewhere around 17,000 new cases. We're down to somewhere about 3,500 new cases as of February 9th. There's a significant decrease. But as we know that still sounds like a very high number, and it is. Our case per 100,000 is still over 700. What we're looking at to get out of that high transmission category is 100 per 100,000 or less, and actually less is where we're headed. And so looking at that we still got a ways to go to reduce the transmission within our community. We're heading in the right direction. It's going at a robust rate. So keep up the great efforts to mitigate this spread within our communities. And as such, as this community spread reduces, the need for hospitalizations, as you've heard in the report, has certainly decreased, and we're thrilled about that. The number of patients who are admitted with Omicron are almost 100% within our communities. So Omicron is what is transmission in our communities. Want to take a pause. There's a concept out there that Omicron is the milder disease of COVID. But overall, mild disease compared to things like Delta and the Alpha variant does not mean mild disease for everyone or mild infection for everyone. We're still seeing deaths. We're still seeing severe hospitalizations. The best way to combat this is get protected yourself by getting vaccinated. If you're not fully vaccinated, meaning completing your primary series, go ahead and get started, complete that vaccination series. If you've already completed that, go ahead and get boosted if you're in that window. That's 5 months out. There's very clear evidence now with the Omicron variant spreading that there's an extra benefit from being boosted above completing your primary series, particularly those greater than 65 and those less than 65 who have risk factors. And we've covered those many times. The important thing is to get boosted. The modeling shows that we have not seen any of a subvariant of the Omicron that's spreading. Denmark seeing a rapid rise in the number of infections to this variant. It is realistic that we will probably see this variant in our state. It may actually overtake the original variant of Omicron. The vaccine and immunity that we are getting in our communities does seem to be effective against this variant as well. So no alarm signals there that we're looking at, but we'll keep you abreast as that data comes in. In terms of vaccine coverage, it looks like 62% around that has received at least a first dose of the vaccine here in the state of Georgia of those who are eligible, and 55% are considered fully vaccinated. Now that's completed the primary series. That is not the boosted. So that there's a difference in the definition there. So we still got a long ways to go to get our population boosted. So it's an important message to try to get out there. The other things that I would like to touch on is the treatment for COVID-19. We've talked about testing, and we know there's some challenges to getting some access to a lot of the testing. Some testing sites often had long lines. Those are improving. But it's important if you are symptomatic to go ahead and get tested. Do not dismiss this as allergies or just a mild cold, or it's just the sniffles. Please go ahead and get tested. Know if you're positive or not. That leads to several things. Number one, isolation and quarantine to reduce the spread. Number two, you can have a conversation with your primary care doctor about treatment options. So if you particularly are at high risk or not completed a vaccine series, there are treatments available. We have a well-established monoclonal antibody treatment that helps reduce hospitalization and death, particularly those at high risk. It's best if used early. That's why I'm encouraging people to go ahead and get tested soon, even when they may have mild symptoms. Don't wait till you feel really bad. These treatments, including the pills I'll talk about in a second, work best if we use them very, very early in the course of illness. So besides the monoclonal antibody infusions, which we have supplies that is increased, it looks like we are starting to develop a actual supply that we have on hand. So we've expanded our reach and the option for people to be able to access that beyond the most high risk. So that is exciting news that we have that available. Thank you, Department of Public Health, State of Georgia, for making those available to our community. Then we have the oral antivirals that are available. Department of Public Health has a website, keeps it very up to date of where these supplies are available. These are under emergency use authorization. Do need to speak to your primary care doctor about whether or not they are appropriate therapies for you. They're not for everyone. There's some drug-drug interactions so that need to be addressed with your primary care or your treating physician for those. But these are best used early. The additional benefits besides getting the person infected treatment and feeling better and preventing hospitalization and death, it reduces the number of symptomatic days. That's a great thing, right? We all want to feel better sooner. Reduces the amount of virus that we shed over time, so it's less likely we're going to infect others. And it also reduces the hospitalization and death. So these are additional benefits to getting that. So please make sure we encourage people to get tested and talk to your primary care provider or your treating physician about what treatment is most appropriate for you. Then looking at the testing, if you're doing antigen testing, home testing, make sure that you utilize those as available to you. And there's several places for those that are available, even free from the government. So that is something I would encourage people to have on hand in case they need. Also, masking, the N95, KN95 masks are the preferred. If you can't have access to those or don't have access to those, it's multiple layers, snug fit. That's the best we look for masking to help prevent spread of this disease within our community. Particularly helpful if you're at high risk and unvaccinated. We do anticipate hearing sometime this month from the FDA about an EU emergency use authorization for vaccination of those less than 5 years old. It would be for 6 months to up to 5 years of age. And we're ready for that. We understand that later this month, there's a plan to roll out millions of doses for that pediatric population. So we'll keep you abreast as that information comes available from the FDA. I mentioned briefly about masks in addition to watching your distance and washing your hands, staying home if you're ill, completing that isolation period. So if you're positive, remember it's 5 days isolation. When you come out, make sure you wear a mask that's snugly fit for additional 5 days, and that's people who are vaccinated or unvaccinated. So please continue to do that to reduce the risk of transmission in our community. And then certainly if you've been exposed and developed symptoms, get tested right away. So thinking about what else can the community do? We talked about blood donations. We're still severe shortages throughout our nation. So blood donations, it's not just for treating COVID or COVID patients. This is for all kinds of blood donation needs for those who are dependent on that life-saving therapy for many, many, many illnesses, such as trauma and critical illness. So please, if you can donate blood, please make an effort to get out there and continue to donate. If you have the ability, start blood drives, work with your blood donation centers to make that possible. I know our community has always stepped up and provided. The other issues I would like for people to take importance right now is the impact on our mental health. We've talked about it before. This is Heart Healthy Month, so we talk about prevention screening and also making sure that you stay up to date on all your chronic illnesses such as heart disease. So it's a great time to mention that and continue to get out there, start exercising as weather warms up, eat a healthy diet. And as part of maintaining health, it's mental health, right? Make sure you get plenty of sleep. Make sure you address these needs with your primary care provider, your behavioral health provider, and certainly take advantage of virtual visits. They are available and they are very effective. And I appreciate all the work that's been done to get that messaging out there. And I'd like to say that we're here to care for you. Please do not delay care. If you have concerns, reach out. We're here for you. I'll turn it back over to you, Mary.
Thank you, Dr. Brandstetter. And with that, I will turn it over to Stephen to give us an update.
Thank you, Mary. Happy to provide today's update as it relates to our community efforts, as well as pinch it for my good friend Lisa Crossman in terms of Cobb Douglas Public Health and our ongoing partnership. Again, we remain grateful for all of our partnerships as we continue to partner on testing sites throughout the county, and I'll share some more information on that in just a moment. Our Congregational Health Network, which is in partnership with Cobb Douglas Public Health, continues to offer vaccination clinics. One will be held on February 16th from 3 to 6 p.m. at the MSBN Church. That church is located at 505 Commerce Park Drive, Southeast, Suite A in Marietta. We're going to be vaccinating adults and children 12 and up, children with a parent and guardian, and they may be vaccinated. Walk-ups are welcome. IDs and insurance cards are requested, but not required. So again, that's February 16th from 3 to 6, and happy to be doing that in partnership with Cobb Douglas Public Health. The WellStar Center for Health Equity and the Congregational Health Network continues their mental health initiative entitled Soul Support. So just as Dr. Brandstatter mentioned about the importance of mental health at this time, we're working in partnership to make sure that we provide behavioral health education, training, and resources at congregations across the entire WellStar service area. The effects of the COVID-19 pandemic have really taken a toll on everyone's health, physical as well as mental. And so this Soul Support program is going to focus on access to mental health care for the community, caregivers, and provides behavioral health resources while supporting WellStar's Zero Suicide Initiative. As I shared before, WellStar has been dedicated to providing COVID-19 community updates and resources, and those can be located on our website, which is wellstar.org/community/COVID-19. There you're going to find a wealth of information, system level information, as well as hospital specific COVID data with the number of patients along with vaccination percentages. And that information has proved valuable for the community, and we are happy to continue to provide that. On behalf of Lisa Crossman, again with Cobb Douglas Public Health, I'm happy to share a few additional updates. Testing demand continues to decline at all CDPH mass sites. For example, the WellStar East Cobb Health Park, Jim Miller Park, KSU, and Epicenter. At those locations, demand is less than 40 tests per day. Because of that, results are coming back in 12 to 36 hours. Effective February 7th, the KSU site testing is now Monday through Friday only. Cobb Douglas Public Health is looking at other sites to reduce hours to assure that we are doing good stewardship of the COVID funding. In order to find more information about most current hours and locations for the Cobb Douglas Public Health testing site, go to www.cobbanddouglaspublichealth.com. There you will get that information around locations, hours, and any changes. Cobb Douglas Public Health also continues to offer 5 to 10 locations per week for outreach vaccinations across the county through CDPH, WellStar, and core staff. We, again, just appreciate that collaborative nature that has really led us through the entire pandemic. Vaccine uptake is still very slow. Cobb Douglas Public Health continues to offer homebound vaccinations in partnership with Pools Pharmacy. The community health worker contract with Morehouse has been approved by all legal staff, but is still in the signing process. Jasmine McLeod with CDPH is working with them and DPH to hire and train 4 to 6 community health workers to deploy around the district in the next 4 to 6 weeks after they get training to help with COVID-19 questions and to link residents to many health and community services. So really excited about that and the impact it can have in Cobb. Cobb Douglas Public Health encourages residents to secure their free rapid COVID test through the government site, which is www.covidtest.gov. As a reminder, the federal free mask program is distributing masks to pharmacies as well that are previously enrolled in the federal vaccine program. So not all pharmacies have access to the free mask. Public Health has also not received any to date. So the Georgia Department of Public Health has a link to all the receiving pharmacies on their website. You should visit that. That concludes Lisa's CDPH report. And as always, we're just so grateful for the partnerships that we have amongst our community leaders, elected officials, Cobb Douglas Public Health, all of our community health workers, as we just continue to get through this pandemic. And we appreciate all of this support. I'll turn it back over to you, Mary. Thank you.
Thank you, Stephen. I just love the way we, every week, we just depict how well we work together and how we can, someone else can jump in and give the next person's report. I love that. Chairwoman Cupid, that is our report on behalf of Wellstar, and I will turn it back to you to take us forward.
Thank you, Dr. Chapman, and I do appreciate the report today and being able to share both from your hospital staff and also from Cobb Douglas Public Health. Are there any persons who are in this meeting who have any questions?
Excuse me, Chairwoman.
Yes, ma'am.
If someone could repeat, there were 3 distribution sites, Truist Park, Word of Faith, and what was the third one?
It's Piedmont Church.
Piedmont Church, thank you.
And we will be giving you some tests as well for senior services.
Great, thank you.
Mm-hmm.
Thank you. I also wanted to get a clarification on a community location, Stephen, that you stated will be working in partnership with Wellstar and Cobb Douglas Public Health on the 16th. It's a church off of Commerce Drive. I didn't get the name.
Yes, I'm happy to provide that name.
Okay.
That name, it's MSBN, the letters MSBN Church, and that's at 505 Commerce Park Drive, Southeast Suite A in Marietta.
All right. Very good. Is that open to the public, Stephen?
It is open to the public. It's for 3 hours, February 16th, 3 to 6 p.m. It's open to the public, adults, and then children 12 and up.
Okay, great. Thank you. Does anyone else have any additional questions? I did have a question. I appreciate Dr. Brandstetter providing information about treatment and our rates of transmission and just the continuing caution, even though our numbers are going down, that we still are at a high level of transmission and need to be mindful of what we can do to help keep the spread down. There was some data I received at different points in time about what the general impact is on the hospitals. I know one of them was that there was a severe impact or impact on persons that may be coming in through ER. I don't know what terminology you use to classify what that impact is, but it's something that we have referred to when we have updated our emergency orders. Is there a classification that you can use to characterize what the COVID impact is to your hospital system that we can pull and share?
Interesting question. I don't know the answer to that off the top of my head. I haven't heard of a classification system. Dr. Chapman, do you have that available for us, or is it something we could just follow up and provide to you once we get that answer?
I think we can follow up. I think she's referring to the NEDOC score in the emergency department, which is one set of piece of data that we look at. We can follow up and give you a little more clarification on that.
Thank you. And if it's, go ahead, I'm sorry.
Yeah, we can. Go ahead.
Yeah, and if that's not the best metric to use, just what this does is allows us to be able to share with the public not only the impact to individuals by the shared case rate, but how is it impacting our hospital system? So if, even if there's just a descriptive sentence you can provide, I want to be mindful of both, because to me, our hospital system is part of our critical infrastructure for the county.
Yeah, we can get with Brandon and follow up. I think the latter that you described is probably more descriptive, because the NEDOC score is a number.
Okay.
Number sort of connects with all of the activity that's happening behind the walls. So we can give a brief description.
Yes, that would be great. Thank you. Other than that, I don't have anything else as far as questions are concerned. I can attest to the rapid turnaround for our testing sites. I received my test results. We've been taking our family often over the past couple of weeks, and we have been getting our test results back in about 12 hours every time that we've gone. So that's been good, but also we've seen that the demand has been low. Typically, I'm either the first or second car that's there. And so I appreciate you letting us know to tell the public to go to the website, as hours may be modified to adjust for, right setting our resources for those sites. Let's see what else I had here. Just thank you, Cassie, for being responsive to Wellstar's call for action with respect to people donating blood and letting people know that that's still a serious concern. Thank you for the reminder, Dr. Chapman, that it is Heart Health Month. So there are some things that we could be doing at the county to help share the word for people to just do what they can to remain healthy. Something I wanted to make a note of is that I appreciate Wellstar's efforts around the Zero Suicide Initiative. Our public services director, Randy Kreider, has been pulling together an intergovernmental team of people inside and outside of the county to help us address mental health. And this was prompted by looking at how we can best utilize our public safety resources so that if people have issues with homelessness or drug addiction or mental health issues, that they're not taking resources that could be used to addressing violent crime. And it's just turned into this effort of let's talk, let's share about what we're doing, what are the resources here, how can we partner? And I would love to get Wellstar to the team with that initiative. And I don't know if you shared that or if that was you, Stephen, you may have shared that, but if you can let me know who's, could be a good contact for that initiative, I can pass that along to Randy.
Absolutely. So I'll follow up and get you that. We'd love to have continued the partnership and collaboration on that.
Okay, excellent. Very good. And just want to share that we are having a forum in honor of Black History Month on policies that impact the African American community. That is going to be held, I think the last Saturday in February, bear with me, Saturday the 26th. I know we've asked Dr. Hines to participate. Stephen, if you're free, I would love to see if you'd be willing to, as I've listened to some of the initiatives that you've had around equity and health. And this we'll have Cobb Douglas Public Health there as well. And we know COVID is big, but there are also some other health issues in Cobb County that are still significant. We know that we have an AIDS, issue here within the county, being ranked one of the top 35 counties of new cases of AIDS. We've had issues with neonatal and maternal health outcomes for the southern portion of the county that we've also asked to be addressed, and there could be other issues that are on Wellstar's radar. So that's all I have today. Just want to say thank you to everyone again. Thank you for being present for this meeting. I hope it's still helpful for me. As we still have these very high rates of transmission, it's important for me to understand what's going on with respect to COVID. So I would like to continue these until we get our numbers lower. However, I'm not here asking people to do things that are redundant. So, I'm sharing with you my interests, but also please just be honest with me about how effective you find these meetings as well, so that we can make sure our weekly 10 a.m. time slot is being utilized as best as we all would like. Let's see. That's all I have on my end. Thank you all for your time here today. Again, appreciate all of you. I hope that you have a great rest of your weekend and that we continue to see these numbers get lower and lower. Yeah, right. Have a wonderful weekend. Take care.